revealed nearly 7,500 new cases of the virus, with 1 in 3 tests coming back positive. The death toll also passed 2,500 when 58 more people died from the virus. The latest White House coronavirus chapter says the state is at a tipping point, and the big issue has been people who are infected but don't have symptoms and are not limiting interactions with other people.
This is how things get accelerated. This is pouring gasoline on a fire. And we have asymptomatic spread that's widespread.
Wisconsin has more than 66,000 active coronavirus cases right now, 7 times where we were 2 months ago.
Tonight, the coronavirus, alarming new numbers just coming in as we come on the air, and the lines in New York City for testing. Growing concern from coast to coast tonight, the testing here in New York, and new restrictions amid fears of a new wave hitting the city. In parts of New Jersey, nearly 1 in 5 testing positive as the number of cases of the virus explodes across the U.S. Well, more than 100,000 new cases every day in America, and no signs of it slowing down. From Ohio to Wisconsin to California, now becoming the second state to hit 1 million cases. Hundreds of people waiting in their cars to be tested at Dodger Stadium. Tonight, we also have news on the Pfizer vaccine and the vaccine in the works from Moderna. And right here, our first look tonight at a treatment while America waits for these vaccines. A new antibody treatment created specifically to attack the virus, speeding up the recovery process. So who can get it, and how does this work? Good evening. It is great to have you with us here on a Thursday night, and we were warned this would happen with the colder weather here and Americans going indoors. Tonight, new numbers on the coronavirus. Well, more than 100,000 new cases of the virus in just 24 hours, several days straight. Hospitalizations nearly doubling in just 2 weeks now. Here in New York, new restrictions tonight, fearing a devastating new wave. And take a look at this time lapse tonight. We started this graphic with the situation about 3 months ago. You can see the red there across the Sun Belt states in August and September, moving up to the center of the country, then moving west. And of course, there's the picture now. We have cases on the rise in all 50 states. Here in New York, lines for testing and a new 10 p.m. curfew for restaurants and bars. Chicago imposing a stay-at-home advisory for the next 30 days. Cases in California tonight now topping 1 million. And this image this evening from Dodger Stadium, families in their cars for hours. They are waiting to be tested. More hospitals and their staffs stretched to the limit. Utah's governor saying we are at a breaking point tonight. And North Dakota, as we reported here, so strapped, they are now allowing workers with the virus but who are asymptomatic to come in to help in this fight. ABC's chief national affairs correspondent Tom Yamas leading us off with the new concern right here in New York.
Tonight, with lines forming outside of testing centers and new restrictions, New York City being warned a second wave may be coming.
Every single thing you do matters.
The epicenter of the U.S. pandemic putting a curfew in place. Bars, restaurants, and gyms need to close by 10 p.m. starting tomorrow. Gatherings in private homes will be limited to 10 people, all to drive those rising COVID numbers down and avoid a return to the darkest days of this pandemic. But small business owners that struggled to survive the first wave say new citywide restrictions will drown them.
There's only a few people sitting down in the restaurant at 10 o'clock, 11 o'clock, and now we can't even accept those 10, 20 customers that we get late at night.
Across the river, cases soaring in New Jersey. 1 in 5 people testing positive in Newark. That state also rolling out a new 10 p.m. curfew tonight for restaurants and bars.
Restaurants were morphing as the night went on, not in name but in substance, into clubs, into lounges. People were just letting their guard down.
Today, 138,000 new cases. In just 11 days, the country recording a staggering 1.2 million infections. Our Will Carr is in California, where today they topped 1 million cases and are adding back some restrictions.
COVID cases are spiking in Los Angeles. In fact, here at Dodger Stadium, they've been forced to extend their testing hours. Across the city, more than 32,000 people are being tested every day, a number that continues to go up.
We should not be throwing our hands up and saying, well, there's nothing we can do. This thing is out of control. There is something we can do.
Officials from coast to coast begging the public to use the tools that work, like Milwaukee's mayor.
I know we're all tired. I'm tired. You're tired. But we must remain vigilant and do what is necessary.
And Ohio's Republican governor amid his new mask mandate.
We know that masks work. They are the easiest, most cost-effective way to limit the spread of COVID-19.
But despite skyrocketing cases, still pockets of resistance to mask mandates. This billboard briefly going up in protest in Omaha, Nebraska. And every day, doctors and nurses on the front lines taking us inside their fight.
It's really bad when you have to decide between a trauma patient and a COVID patient.
In Missouri, 40-year-old medical technician Marie Brumbaugh took precautions but still got the virus. Her parents on the phone with Marie moments before she was put on a ventilator and later died.
Her last words to me were, "I love you." And her dad was driving and he says, "I love you, baby girl." And he says, "I love you, Dad. I love you." And that was it.
So many families across this country going through those moments. Tom Llamas joins us now from New York. And of course, we're seeing this across the country, Tom. New concerns here in New York tonight as well, and a new advisory in Chicago at this hour.
That's right, David. That breaking news coming out of Chicago moments ago. The mayor issuing an advisory starting Monday at 6 a.m. People should only travel to work, school, and for essential needs. Back here in New York City, we are seeing the warning signs all around us. These are people waiting in line to get tested. David, they were waiting tonight when the rain was pouring down for hours. And the big question right now, what's going to happen to the public schools? Mayor de Blasio said today if the infection rate gets to 3%, he's going to shut them down. David, tonight it's at 2.6.
It's steadily rising. Tom Llamas leading us off tonight. Tom, thank you. There's also news tonight on the Pfizer vaccine and the vaccine coming from Moderna. And tonight,
coronavirus, researchers taking the most powerful antibody from one of the first survivors and using it to create a synthetically made version to fight the virus.
When the fever came on, then I knew things were really beginning to look bad.
David Schultz is one of the first COVID patients in the country to receive Eli Lilly's new FDA-authorized antibody treatment, bamlanivimab, at Clark Memorial Hospital in Jeffersonville, Indiana. Schultz, a doctor on the front lines treating COVID patients, tested positive a couple of days ago.
You just got your infusion. Describe how that was. What happened?
They hooked me up to an IV, and they gave me the 1-hour infusion of the monoclonal antibody. There were no side effects to it, and I'm assured that this is going to speed up my recovery.
You must begin treatment within 10 days of the first symptoms, and after receiving an infusion, patients go home to recover, freeing up valuable hospital space and staff.
This is a treatment that can keep them from becoming sick enough to be in the hospital. So it keeps them out of the healthcare system.
But only certain patients are eligible, must be 12 years or older with mild to moderate symptoms and likely to develop severe illness, including many with pre-existing conditions like diabetes and obesity. It's not for people already in the hospital. Availability is limited. 88,000 doses ready now, 212,000 more expected by the end of the year.
Is this the bridge that we needed until we get that widely available vaccine?
This has given us hope. It's given us that ray of sunshine to say we have something that will help patients from getting sicker.
And from this new treatment for those who have it to the vaccines meant to prevent it. Pfizer says early data shows its vaccine could be 90% effective and may apply for emergency authorization as soon as next week. And Moderna not far behind with their vaccine, saying they could be ready to apply by next month.
And David, doctors across the country are learning more about this new treatment right now, along with the rest of us. If you believe you're a candidate for this new treatment, you should contact your doctor or medical provider, and they will help. David?
All right, we could use some promising news on this front. Alex, thank you.
2 News at 6 starts now.
Good evening. Thanks for joining us. Another day, another shattered record for Wisconsin with nearly 7,500 COVID-19 cases in 24 hours, surpassing the record set just 5 days ago.
The state is now nearing 300,000 confirmed cases since the first case back in February. More than 2,500 COVID-19 deaths since the first in March. Taking a closer look now at today's report. Positivity rates now sits at nearly 33.5%, still well above the 5% health experts want to see. 58 more people have died, which is slightly lower than the past 2 days. 246 more people have been hospitalized. Nearly 2,200 people are being treated for the virus right now. Here now, look at the coronavirus cases in our area. In northeast Wisconsin, Winnebago County is reporting the most at 397, followed by Brown County reporting 340.
As those case numbers continue to rise, Governor Tony Evers keeps spreading the same message that he has for months now. During today's DHS briefing, the governor told residents that he will continue to educate Wisconsinites on what they have to do in order to get back to normal.
We're going to do anything in our power to make sure that people understand the importance of this, whether it's issuing another order, doing something similar to that at local level. But the people of Wisconsin have to feel confident that we will do everything we can to make sure that people are wearing masks and keeping socially distanced in the state.
He added that other government leaders also need to step up to help mitigate the situation.
Right now we're in Some local health experts say the President and CEO Dr. Ashok Rai joined Action 2 News this morning today. He says even with a small change in numbers, hospitals are at their limits, and now they need help from everyone else to make it better.
Leaving the hospital after undergoing a double lung transplant because of the virus.
Hi. Thank you. Congratulations. See you soon. I know.
Carmen Lerma was transferred to University Hospital in Madison in October after a long battle with COVID-19. Doctors say the disease was so damaging to her lungs that a double lung transplant was her only chance of survival. Lerma is the first person in Wisconsin to undergo a double lung transplant because of COVID-19.